You are now listening to the Lunch and Learn with Dr. Barry. This is episode number 8.
Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Welcome to the Lunch and Learn with Dr. Barry. We're going to be talking about the dangers behind colon cancer. And if you want today's show notes, please go to drpierresblog.com/LLP008. If you forget that the code's actually in the title as well, drpierresblog.com/LLP008. So again, we said we're going to be talking about colon cancer, and I'm going to be going over topics including what is colon cancer, who's affected by colon cancer, some startling facts and figures as far as colon cancer not being an old person's disease anymore, and what we can do to prevent it. So get ready for today's episode. We're going to talk about colon cancer, and in particular, especially, go ahead and read that blog, and particularly the concern that, more young people are being diagnosed with colon cancer at unfortunately alarming rates, which is something that definitely should not be happening. Looking back, colon cancer used to be what we would consider this old person's disease, but now we got more and more younger patients. And when I say young, take a look at the article, you'll see that the age group that's being affected, it can barely, get a credit of their car insurance. Like they're so young. So definitely, something that we as physicians and then we as patients abroad need to definitely look out for when we talk about colon cancer. Appreciate you for sharing the video, Gino. So again, let's talk about it. Let's just get right into it. Colon cancer, and for those who may not be aware of where the colon is, it's part of the large intestine. And when we talk about colon cancer, we actually talk about colorectal cancer because it pretty much includes every part, after food kind of leaves your stomach until it leaves your body. We won't be too graphic here on the Lunch and Learn. That whole strip of body tissue is called your small and large intestine, but in particular the large intestine is what we're concerned about here when we're referring to colon cancer. And just a quick facts. Back in the day, colon cancer used to be considered this old person's disease. From a primary care standpoint, colon cancer wasn't something that I even tested for until you got to the age of 50. Just to give you an idea. But this recent article that was published talked about the fastest group of people who are being diagnosed with colon cancer is now between the ages of 20 to 29, which is scary to say the least. Because not only are they being diagnosed at such an earlier age, when they get diagnosed, their disease is definitely at a more further progression than others. So it's definitely something that was very eye-opening for me. And of course, something like that would just happen to drop during Colon Cancer Awareness Month, where we were just gonna get ready to kind of educate the masses on getting your colonoscopy of concern. So let's talk about some signs and symptoms of colon cancer. And again, this is something that used to be referred to as an old person's disease. It used to be something that we'd always have to be concerned that someone, your mom, your dad, your grandparents had to deal with. But now, we definitely have to take a much better look at everybody. Moving forward, I unfortunately had a patient of mine who was diagnosed with colon cancer at a very early age. So it was definitely something that definitely strikes home for me. Hey, Dr. Shanika, thank you for joining. Definitely strikes home for me when we talk about the disorder. So, let's talk about some signs and symptoms of, that I need to be worried about. And the most common that you'll hear is, blood in my stool, or a change in color in the stool. That's usually the most common, complaint that I get in my office, that prompts me to have to send a patient over to our gastroenterologists, who are the doctors who do the colonoscopies. But it doesn't even have to get that far. There's a lot of patients who never have any blood in their stool, who never have any darkened stool, different color stool, who still we need to be concerned about. If you start noticing a change in your bowel habits, maybe you normally used to go to the bathroom every 2-3 days, and now all of a sudden it's taken 5-6 days, to go, use the number 2. That's a concern. That's something we need to, be very mindful on. Maybe it instead of being constipated, maybe now you're having more the loose stool. Maybe you're having more diarrhea like stools. Again, something that what's really isn't concerning is like what the stool looks like. It really is that change that's happening. Before, if you're normal and then you have this abnormal change that's seeming to occurring, that prompts me to say, like, what, maybe we need to get you looked at. I have some patients who have actually had a change in the size of their stool. Like they, and you'd be surprising, a lot of people look at that stool, right? So that's one thing I want to kind of get out there, right off the bat. Everybody should be looking at their stool before they flush, right? Like no one should be using the number 2 and then flushing without even looking at it, because that's just crazy, right? So let's just get that out there right now. Let's get all the nastiness out the way. Everyone should be looking at their stool before they flush it away. Because again, how are you going to notice a change if you never actually look at your stool? And so if you haven't been, for some crazy reason, if you haven't been doing it today, I want everyone to start looking at your stool every time you go to the bathroom, every time you use the restroom. So we have the change in, so we've talked about, number 1, we talked about bloody stool. We've talked about a different color stool. Maybe like it's dark, maybe it's gray. 2, we talked about a change in your bowel habits. Maybe before you were pretty regular on the clock and now you're on the constipated side. But maybe before you were regular and on the clock and now you're having more looser stools. Abdominal pain, that's another concern for ours. And I can tell you, unfortunately, colon cancer, that is not a very common presentation, like a lot of, which is unfortunate, because a lot of times you don't have any pain or discomfort when you have the colon cancer. It's because colon cancer is a very slow growing disease. It's something that takes years, to progress. It's something that you even need to be concerned about. So we have these these lists of symptoms here that that kind of present in ways that we should always be concerned about. We talked about gassiness as well. If you again usually a lot of this is like a change. Like before, now you're like extremely gassy. Now you're extremely, foods that you used to be able to tolerate, you don't tolerate anymore. These are some things that again prompt us, the primary care physician, to move that patient along to the next person, which is usually your gastroenterologist, who's our stomach doctors, to take action to possibly get that colonoscopy. So let's kind of fast forward. Let's say you have all of these symptoms. You came to a doctor like me, and I was smart enough to send you to get this colonoscopy. What next? When you hear about the colonoscopy, the biggest concern most patients who've had a colonoscopy is that prep work, right? Like a lot of people don't like to take, because it's like this Gatorade type solution, and the reason why they don't like doing it, which is crazy, because that's the number one reason why people don't do the colonoscopy. Not for the colonoscopy aspect of it, because they do not want to deal with the prep work to get the colonoscopy, which again is crazy, because I'm going to give you some numbers, that's unfortunately startling in our case here. But a lot of people don't like to do the prep work. It's usually some a solution that you got to take to kind of help clean out your system. And why you want to do that? Because if you think about what a colonoscopy is, they're pretty much taking like a tube and looking up your rectum, and then like it's a camera, so they're looking up to see if there's anything that they notice. And when they say anything, masses, polyps, which almost you could consider like little pimples that kind of form inside your colon. And the reason why those are important is because those little pimples are what will eventually become, if you do nothing about it, cancerous. Like if you do nothing to those pimples, they will become cancerous. There is no pimple that's going to grow there and then not cause any problems, which is why anytime a person has the colonoscopy, if they find what they call a polyp, they always take it out, because there's absolutely no reason why they should be leaving them in there for that cause, because we know the chance of them becoming cancerous later on, is through the roof. So just so kind of backtracking, you have these patients who don't want to go through the prep work of getting the colonoscopy done. So because they don't want to go through the prep work of getting a colonoscopy, they just kind of shoo it all together. And that's bad, right? Because the colonoscopy, from when you talk to people, it's usually painless. You're usually under anesthesia. You don't usually most of the anesthesia that they give you don't even remember that you even had a colonoscopy, right? They give you this type of anesthesia that you probably the past 30 minutes that happened, you have no clue what actually happened. So it's an extremely painless procedure. But again, you have such animosity and such opposition to even get the procedure. We can't even get people that far ahead. So I like to do my numbers, because a lot of times a lot of us like to think about numbers from an aspect here. Let's think about colorectal cancer, right? Second leading cause of cancer death in men and women. Third most commonly diagnosed cancer. But this is the case here, right? In 2017, they already estimate about 135,000 people will die from colon cancer, which is bad, right? But this is the kicker: 60% of them, right, could have been prevented. 60%, which is disheartening. If you had to choose, right, and of course, no one wants to choose cancer. Cancer is terrible for everybody. But if you had to choose to have a cancer, you want colon cancer. Why? Because colon cancer is one of the one of the slowest growing cancers that we know of. So that you can have a colonoscopy today, get a clean bill today, and we don't have to check you for another 5 to 10 years. Like, think about that. Like, we can screen you and do something today, and for 5 to 10 years, we don't have to mess with you. Which means you only have to go to that prep once every 5 to 10 years. You only have to, drink that fluid and, clean out your system once every 5 to 10 years. And what's funny now, because you have people who do like these like colonic cleanses, right? Because they want to, remove the toxins out, right? And those same type of people won't get a colonoscopy. Like, think about it. The same procedure that you do to get a cleanse, to, remove toxins. We can talk about the whole colonic cleanse, we can talk about that. The same people who will do that won't get a colonoscopy. Like, it blows my mind. Some of the stuff we do, but again, I think a lot of it's just from an education aspect. Like, again, if I told you the same procedure to get your colon cleanse is the same procedure that you'll do to get your colonoscopy, I think less and less people would have an opposition to getting the colonoscopy. But here we are. We're in a setting where we got the best technology in the world, and yet 60% of our patients are going to die from a cancer that we could have prevented if we could have just did a colonoscopy. So that's definitely concerning, right? And 1 in 20 people are going to be diagnosed in their lifetime. 1 in 3 people are not up to date on screenings. 1 in 3. 33% of the people who should be getting a colonoscopy are not even up to date. Again, so this adds to it. So these are people who are eligible to get the colonoscopy, and they're not doing it. And now they have no excuse. Well, let's say now, because I'm not sure what the Republicans are doing. But now the colonoscopy is covered. Like, it's covered in your plan. You pay no copay. Like, I think you pay no copay. So the colonoscopy is essentially free. But we still can't get people to do that. We still have 1 in 3 people who don't get screened. We still have 60% of people who die from a cancer that we could have easily prevented. Again, which when you hear those numbers are startling. So when we talk about the article, the blog post I did yesterday, and when we talk about that article, when it says now the fastest age group to get diagnosed with colon cancer or rectal cancer is between the ages of 20 to 29. Like, think about that, right? You're not even 30 yet. 30 and 20 to 29, you're having an increased risk of getting colon cancer. And what tends to happen, what I like to call you guys. Those are my superhuman, patients, because those are the ones who don't think they need to see a doctor for anything. So not only are we diagnosing them more frequently with colon rectal cancer, when we get them, their disease is much worse because again, they had those same symptoms we talked about earlier, and they ignored it. They didn't go see the doctor. They didn't go see the doctor until it was too late. Right, so that's kind of where we're at now from a setting with colon cancer, and the article talked about several different causes of colon cancer and why they think the young population is definitely being more affected. They talked about cigarette smoking. My thoughts on cigarette smoking. They talked about alcohol use. They talked about diet. We do know there's some association with obesity in relation to cancer in general, but in particular colon cancer. Alcohol, again, in relation to colon cancer. So a lot of these different risk factors that are out there that we haven't seemed to be able to pin down, unfortunately, in our younger population. So again, and just to kind of recap, because again, it's definitely something that you'll be seeing me do a few blog posts this month on different colon cancers and how it affects different populations. This is definitely something that we should be preventing. As a primary care physician, this is something that we should be preventing. We need to educate our patients as much as possible. We need to break down any ridiculous superstitions regarding the colonoscopy, because again, like I said, this is not something you should be getting. We should be allowing to go. Again, 1/3, 60% of deaths could be prevented from colon cancer if they just got the colonoscopy. We're not even doing that. And I think another point that the article pointed out, that these younger patients, because I talked earlier, like, when should you get the colonoscopy, and it's usually at the age of 50. But if you have a relative, uncle, mom, dad, some older relative who got it, around the age of 50 or even sooner, that timetable gets pushed back 10 years before. So if let's say my uncle gets colon cancer, or let's say my uncle gets colon cancer at the age of 45. All of his kids got to start getting colonoscopies at 35, just to give you an idea of what happens if you get a family member who has colon cancer. And just judging by the numbers, second leading cause of cancer death among men and women. A lot of people's families know someone who has colon cancer. So this is definitely not something that we can ignore moving forward. So just to kind of recap, we talked about our symptoms for colon cancer. We talked about the change in stool. We talked about the change in the size of the stool. We talked about the change in frequency. We talked about either going, be more constipated, more diarrhea. We talked about bleeding, because bleeding is a very common cause. We did talk about pain, but with the caveat that a lot of patients will not have pain when they're having colon cancer. Pain is not usually a primary symptom that we have to deal with. And then moving forward, we talked about who gets tested. Usually starts at the age of 50, unless you had a family member who had it, between 50 and 60, or even earlier. Then that timetable gets pushed back for everybody after him by 10 years, or pushed up, I should say. So if my uncle had it at 50. Everybody starts at 40. That's the way it goes. And I think the article talked about that would being a reason why a lot of our patients are being diagnosed with colon cancer, especially my younger patients, because we're missing the boat on their family members. We're not diagnosing the family members well, or even if we're not diagnosing them, we're not taking a good enough history. So then when we should be getting these kids earlier, we're not doing it. And then of course we see where the problems arise from that standpoint. And again, the treatment is simple. Get your colonoscopy. get your colonoscopy. Deal with the 2 to 3 days of having to cleanse your colon, because again, first of all, let me tell you something. You rather have a clean colon so they can do that colonoscopy one time than to have that gastroenterologist tell you, well, you know what, you didn't really do a good prep. And this happens a lot, unfortunately, because people be trying to cheat. People are trying to, I'm not going to drink as much as they say they drink. And then when they do the colonoscopy and they can't see anything, and they tell you got to come back next month, you be looking like Boo Boo the Fool. So please, avoid, that this superstition that, having colonoscopy is dangerous. Does it have its risks? Sure. But so does colon cancer, right? So colon cancer has its risk too, right? And there's risk of death. And, if you had to choose, like, I got to spend a couple of days, drinking this, this, and usually the drink looks like this, right? It looks like something like this. It's usually flavorful. You drink it, it cleans out the system. Again, to my people who like to get colon cleansers, this is the same exact thing. Cleans out the system, lets the gastroenterologist kind of do their thing with no impediment, and being able to see everything. Because this is a test you want to do one time. And again, when you do it the one time, if they find absolutely nothing, they say come back in 10 years. If they find like a little polyp or two, they say come back in 5. And this is a test that we know saves lives, but we know we're not doing a good enough job at it. So again, I'm going to head on out. Again, Maria, thank you for joining. Thank you for joining, liking, and sharing. Much appreciated. I want you guys to go ahead and share this on your family members' page who either knows of someone who has colon cancer or has colon cancer or diagnosed with colon cancer. Is extremely important.
Thank you for listening to this episode of the Lunch and Learn with Dr. Barry. If you want to find out more about the episode, please go to www.lunchlearnpod.com. That's www.lunchlearnpod.com for the show notes and any links that may have been mentioned in today's episode. If you're interested in joining the Lunch Learn Pod community, head over to either the website lunchlearnpod.com or join us on Facebook and Twitter with the same username, Lunch Learn Pod. And again, you can find all of these links on the website. If you have any questions, any comments, or any requests for topics to debut on the show, please let that be known. And don't forget to use the hashtag LunchLearnPod when you're listening to the episode. Again, I want to thank you for taking the time to listen to today's episode, and I'll see you next week.